Hello everyone. The topic of our group is behavior modification in oppositional defiant disorder and kleptomania. And our group members have BINGYU, FANG JINHUI, and XIRUO. Okay, let's add to the first part. General introduction. Behavior modification is practical approach in psychology that focuses on change maladaptive behavior through established learning principles, unlike approaches that emphasize thoughts of unconscious process. Behavioral interventions focuses on observable behaviors and the environmental factors that influence them. A variety of techniques have been developed based on classical and operant conditioning, such as positive reinforcement, torture economy, shaping attention, and contingency management. These methods are widely used because their outcomes can be observed and measured objectively. This This topic focuses on two disorders. The first one is oppositional defiant disorder. It's also called ODD, which involves persistent defiant behaviors toward authority figures, and kleptomania, an impulse control disorder characterized by recurrent stealing behaviors. From a behavioral perspective, both disorders are maintained through reinforcement process. Therefore, this report examines six case studies to explore how behavioral interventions can be applied to modify these maladaptive behaviors and improve individual functions. Okay. Okay, let me go into an introduction for my two cases. Behavioral therapy is a psychological approach that focuses on observable behavior and the environmental factors that influence it. Instead of analyzing thoughts or unconscious process, it implants behavior through learning principles such as reinforcement and conditioning. In my cases, I will focus on two clinical cases. The first is oppositional defiant disorder based on a study by Chadra in 2025. This case uses operant conditioning principles. The second is kleptomania based on the 1972 study, which is planned using classical conditioning principles. Although these two disorders are very different, both are treated using behavioral methods that aim to modify non-maladaptive behavior through environment changes. Okay, next one is background for ODD. ODD is a childhood behavioral disorder characterized by persistent patterns of defined, argumentative, and non-compliant behavior toward authority figures. Children with ODD often refuse instructions, argue with adults, show irritability, and sometimes display aggressive emotional outbursts. These behaviors can seriously affect their academic performance, classroom behavior, and social relationships with peers and teachers. From a behavioral perspective, these behaviors are not seen as personality traits, but also learned behaviors shaped by environmental consequences. For example, if a child avoids doing schoolwork after refusing instructions, that avoidance becomes negatively reinforced. Similarly, Similarly, if attention is given after disruptive behavior, even negative attention can strengthen the behavior. Okay, next one. Now, let us tutor to math knowledge. The intervention for ODD was based on applied behavior analysis. It also called ABA. The first step was functional behavior assessment, also known as FBA. This involved observing the child in classroom settings and collecting teacher reports to understand when and why the behaviors occurred. The results show that oppositional behavior mostly happened during academic tests or test transitions. These behaviors were usually followed by escape from tests or inconstant attention, which helped maintain the behavior. After this, baseline data was collected to measure the natural frequency of behaviors before intervention. Target behaviors were also clearly defined in measurable terms, such as following instruction with a time limit, completing tests independently, and cooperating during classroom activities. The main intervention was the total enrollment system, where positive behaviors were immediately reinforced using tokens. These tokens could later be exchanged for rewards. In addition, structured verb reprimands were used to provide immediate feedback when operational behavior occurred. Finally, continuous behavioral monitoring was used to record all behavioral changes throughout the interventions. Okay, turn to the results and theory. The results show clear improvements in the child's behavior. Compliance increased, meaning the child followed instruction more consistently. Test completion also improved significantly and defined behaviors such as agreeing and refusal decreased over time. From a behavioral theory perspective, these results support operant conditioning principles. Behaviors that are reinforced, such as compliance, increase in frequency. On the other hand, behaviors that are not reinforced, such as defiance, gradually decrease. This demonstrates that change in environmental consequences can directly influence behavioral outcomes. Okay, next, the other study case, kleptomania. The first is their background. Kleptomania is classified as an impulse control disorder involving repeated inability to resist stealing urges. Unlike normal theft, kleptomania is not motivated by financial gain, instead it's driven by emotional process. Individuals typically experience increasing tension before stealing, followed by temporary reliefs after the act. From a behavioral perspective, this creates a negative reinforcement cycle. The stealing behavior reduces emotional tension, which makes the behavior more likely to repeat. Over time, environmental cues such as shopping environments or valuable objects become condition triggers that automatically activate these urges. Okay, let's turn to the kleptomania method. Methodology is divided to two parts. The first part is the intervention focused on identify triggers and preparing relaxation skills. Trigger identification involved observing situations that cause anxiety and stealing urges. This included retail environments, seeing unattended objects, and imagining safety-related scenarios. These situations consistently produced emotional tension, which were recorded as part of the behavioral pattern. After that, relaxation training was introduced. This included deep breathing exercise and progressive muscle relaxation. The participants practiced repeatedly until they could reliably reach a relaxed state. This is important because in behavioral theory, relaxation and anxiety are incompatible responses. This means relaxation can be used to block anxiety responses during treatment. Okay, next to the part 2. The second stage involved constructing an anxiety hierarchy and applying systematic desensitization. All trigger situations were ranked from low anxiety to high anxiety levels. This ensured that exposure could happen gradually and safely. During treatment sessions, the participant first entered a relaxed state using relaxing techniques. Then, then they were exposed to the lowest level of the anxiety hierarchy through imagination. If no anxiety appeared, they moved to higher levels. If anxiety occurred at any stage, relaxation training was repeated before continuing. This repeated pairing of relaxation with anxiety provoking situations is the core mechanism of systematic desensitization. Over time, it weakens the non-anxiety response associated with stealing. Okay, next one is results. Results showed a gradual reduction in anxiety responses related to stealing situations on the beginning of treatment. This situation triggers strong emotional tension and urges. However, over time, the intensity of these responses decreased significantly. The participants also showed reduced stealing urges and improved emotional control in previously threatening situations. This improvement can be explained through reciprocal inhibition where relaxation replaces anxiety responses. As a result, the connection between triggers and stealing behavior was gradually weakened. Okay, next is comparison with two others. Although ODD and kleptomania are different disorders, both are independent using behavioral learning theory. The main similarity is that both focuses on observable behavior and environmental influence rather than internal thoughts. However, the main difference lies in the conditioning process. ODD is based on operant conditioning, where behavior is shaped by consequences such as reinforcement and punishment. In contrast, kleptomania is based on classical conditioning, where emotional responses become associated with environmental cues. In ODD, the goal is to change external behavior through reinforcement systems like total economy. In kleptomania, the goal is to change internal emotional responses through relaxation and desensitization. Despite these differences, both show that maladaptive behaviors are learned and can therefore be modified. Okay, finally, in conclusion, both case studies demonstrate the effectiveness of behavioral interventions. The ODD case shows that operant conditioning techniques such as total autonomy and structured feedback can improve compliance and reduce defined behavior. The kleptomania case shows that systematic desensitization can reduce conditioned anxiety responses and decrease stealing urges. Overall, these findings support the behavioral assumption that behavior is learned through environmental interaction and can therefore be changed through structured interventions. This highlights the practical value of behavioral therapy in treating different psychological and behavioral disorders. Okay, I finish my part. Next one.
Good morning. Today I will be presenting two case studies that demonstrate the applications of behavior modification techniques in clinical settings. The first case focuses on obsessional defiant disorder, or ODD, while the second case examines kleptomania. Behavior modification is based on the principle that behavior is learned through interactions with the environment. Therefore, if maladaptive behaviors can be learned, they can also be changed through appropriate interventions. Behavior modification aims to increase desirable behaviors and reduce problematic behaviors using evidence-based techniques such as reinforcement, modeling, self-monitoring, and cognitive behavioral strategies. The two disorders selected for the review are quite different. ODD is commonly diagnosed in childhood and is characterized by defined hostile and aggressive behavior towards authority figures. Kleptomania, on the other hand, is an impulse control disorder that involves recurrent urges to steal items that are not needed for personal use or financial gain. Although the disorders differ in symptoms and age groups, both studies demonstrate how behavior interventions can help individuals develop more adaptive patterns of behavior. In this presentation, I will review the intervention procedures used in each case study, discuss their effectiveness, and explain what these findings contribute to the field of behavior modification. The first study was conducted by Kalub and colleagues in 2021 and involved a preschool-aged boy diagnosed with obsessional defiant disorder. The child displayed a variety of disruptive and aggressive behaviors. This included hitting, kicking, throwing objects, temper tantrums, and refusing to follow instructions from adults. Such behaviors occurred both at home and in school, creating challenges for parents, teachers, and peers. To address these issues, the researchers implemented a multimodal cognitive behavioral treatment approach. The intervention did not focus only on the child but also involved important adults in the child's environment. One major component were parent training. Parents were taught how to provide clear instructions, reinforce positive behaviors, and respond consistently to inappropriate behaviors. Instead of relying heavily on punishment, the intervention emphasized positive reinforcement to encourage desirable behaviors. Teachers were also included in the intervention process. They were encouraged to apply similar behaviors strategies in the classroom so that the child would experience consistent expectations across different settings. The intervention also incorporated cognitive behavioral techniques appropriate for the child age. This technique helped the child recognize emotions, develop coping skills, and learn alternative ways of responding to frustration. Overall, the treatment targeted both behavior symptoms and emotional regulation skills. The intervention produced several positive outcomes. According to reports from both parents and teachers, aggressive behaviors decreased significantly over the course of treatment. The child became more cooperative, followed instructions more frequently, and demonstrated better emotional control when faced with challenging situations. Another positive outcome was the improvement in social interactions. The child showed better relationships with peers and adults, which is particularly important because disruptive behaviors often interfere with healthy social development. One strength of the study was its multimodal design. By involving parents, teachers, and therapists, the intervention addressed the child's behavior across multiple environments. This consistency likely contributed to the positive results observed. Another strength was the use of positive reinforcement. Rather than focusing solely on punishment, the intervention rewarded desirable behaviors, helping the child learn more appropriate ways to interacting with others. However, there were limitations. The study involved only one participant, making it difficult to generalize the findings to all children with ODD. Additionally, the intervention required substantial commitment from parents and teachers, which may not always be feasible in real-world settings. Despite these limitations, the case provides strong support for behavioral interventions in treating ODD. The second study focused on kleptomania. The participant was an adult woman who experienced repeated urges to steal items. Importantly, the stolen items were not taken because of financial need or personal usefulness. Instead, the behavior was driven by psychological urges that the client found difficult to control. Before stealing, the client often experienced feelings of tension and anxiety. After stealing, she reported temporary relief or satisfaction. However, these feelings were usually followed by guilt, shame, and fear of legal consequences. The treatment combined several cognitive and behavioral techniques. One important strategy was self-monitoring. The client recorded situations that triggered stealing urges and documented the thoughts and emotions associated with those urges. This process increased awareness of behavioral patterns. Another technique was cognitive restructuring. The therapist helped the client identify irrational beliefs and replace them with healthier and more realistic thoughts. The intervention also used covert sensitization. In this procedure, the client imaged stealing and then immediately visualized the negative consequences, such as embarrassment, social rejection, or arrest. The goal was to create a negative association with stealing behavior. Behavioral rehearsal and homework assessment were also included the strengthen alternative coping responses. The treatment achieved positive results. Over time, the client reported fewer stealing urges and increased confidence in her ability to resist temptation. Self-monitoring records also indicated reductions in both the frequency and the intensity of urges. One reason for the success of the intervention was that it addressed both behavioral and cognitive factors. Self-monitoring improved awareness of triggers, while cognitive restructuring targeted distorted thinking patterns. Covert sensitization was particularly useful because it reduced the emotional rewards associated with stealing. By repeatedly pairing stealing with negative consequences, the intervention weakened the urge to engage in the behavior. Overall, the case demonstrates how cognitive and behavioral techniques can work together to help individuals manage impulse control disorders more effectively. These two case studies provide several important implications for behavioral modification practice. First, they demonstrate that behavioral interventions can be successfully applied across different age groups and disorders. Despite the differences between ODD and kleptomania, both clients benefited from structured behavioral treatment. Second, the studies highlight the importance of individualized treatment planning. Effective interventions are not one-size-fits-all. Instead, therapists must identify the specific factors, maintain problematic behaviors, and tailor interventions accordingly. Third, the findings support the integration of cognitive and behavioral approaches. Behavioral techniques help change observable actions, while cognitive techniques address the thoughts and emotions that contribute to those actions. Finally, both studies emphasize that the importance of ongoing monitoring and evaluation. Monitoring allows therapists to assess progress and make adjustments when necessary, increasing the likelihood of successful outcomes. Although both studies were based on behavioral modification principles, there were several important differences. The ODD intervention focused on a young child and therefore required extensive involvement from parents and teachers. In contrast, the kleptomania intervention focused on an adult client and relied primarily on individual therapy. The primary behavioral technique was also different. The ODD intervention emphasized positive reinforcement and behavior management, whereas the kleptomania intervention focused on self-monitoring and covert sensitization. Another key difference involves the nature of the target behavior. ODD primarily involves observable external behaviors, such as aggression and defiance. Kleptomania, however, involves internal urge and impulses that may not be immediately visible to others. Despite these differences, both interventions achieved positive behavior outcomes, highlighting the flexibility and effectiveness of behavior modification approaches. To conclude, both case studies demonstrated the effectiveness of behavioral modification interventions in addressing problematic behaviors. The ODD case showed how parent training, teacher involvement, positive reinforcement, and cognitive behavioral strategies can reduce aggression and improve compliance in young children. The kleptomania case demonstrated the effectiveness of self-monitoring, cognitive restructuring, covert sensitization, and behavior rehearsal in reducing stealing urges and improving self-control. Together, these studies illustrate that behavior modification is a versatile and evidence-based approach that can be adapted to different disorders, age groups, and treatment settings. Thank you for your listening. That's all my part.
Good morning, everyone. My name is FANG JINHUI. As the final presenter for this group assignment, I will be discussing two case studies that examine the application of behavioral interventions in treating obsessional defiant disorder and kleptomania. Both disorders involve maladaptive behavioral patterns that can significantly affect an individual's daily functioning and quality of life. However, they differ considerably in terms of their symptoms, developmental characteristics, and treatment needs. The purpose of this review is to examine the behavioral treatment approaches used in both case studies, evaluate their effectiveness, and discuss their implications from a behavioral modification perspective. Let's begin with the first article, which focused on a 9-year-old boy diagnosed with ADHD, obsessional defiant disorder, and dyslexia. The child displayed several behavioral difficulties, including obsessional and defiant behavior, emotional dysregulation, impulsivity, academic challenges, and social problems. Due to the complexity of the case, the researchers adopt a multimodal intervention approach consisting of cognitive behavioral therapy, parent-child interaction therapy, and educational support. Rather than focusing only on reducing disruptive behavior, the intervention aimed to improve the child's emotional, social, and academic functioning simultaneously. The intervention was implemented through several stages. The first stage involved assessment and goal setting, where therapists identify target behaviors and establish treatment objectives. The second stage was cognitive behavioral therapy. During this phase, the child learned to recognize emotional triggers, identify maladaptive thoughts, and develop healthier coping strategies. The third stage involved parent-child interaction therapy, or we also can call it PCIT. Parents were trained to reinforce positive behaviors, provide consistent feedback, and establish clear behavioral expectations. Educational support was also provided to address learning difficulties associated with dyslexia and reduce frustration during academic tasks. Throughout the invention, progress was continuously monitored and treatment strategies were adjusted when necessary. Several key behavior modification techniques were used, including self-monitoring, positive reinforcement, cognitive restructuring, parent training, and behavior shaping. The invention produced positive outcomes across multiple areas. The child demonstrated fewer oppositional behaviors, improved emotional regulation, greater compliance with parental instructions, and better academic performance. Social interactions also improved, suggesting that treatment gains extended beyond the therapy setting. One major strength of this study was its multimodal design. By integrating CBT, PCIT, and educational support, the intervention addressed several contributing factors simultaneously. From a behavior modification perspective, positive reinforcement played a particularly important role in strengthening adaptive behaviors and reducing problematic ones. However, the study also had limitations. Since it involved only one participant, the findings cannot be generalized to all children with ODD. In addition, because the child has both ADHD and dyslexia, it is difficult to determine which intervention component contributed most to the observed improvements. The second article focused on kleptomania, an impulse control disorder characterized by a recurrent urge to steal items that are not needed for personal use or monetary gain. Individuals with kleptomania often experience psychological tension before stealing and temporary relief afterward, followed by feelings of guilt or shame. The intervention in this case study was based entirely on cognitive behavioral therapy. The primary goals were to identify behavioral triggers, challenge irrational thoughts associated with stealing, strengthen impulse control, and prevent relapse. About the behavior treatment process, the intervention consisted of 6 major stages. First, the therapist conducted an assessment and functional analysis to identify triggers and maintaining factors. Second, psychoeducation was provided to help the client understand the nature of kleptomania and increase treatment motivation. Third, cognitive restructuring techniques were used to challenge distorted beliefs and replace them with more adaptive thinking patterns. The fourth stage involved self-monitoring, where the client recorded urges, thoughts, emotions, and behaviors. The therapist also introduced response prevention strategies to help the client resist urges without engaging in theft. Finally, relapse prevention techniques were implemented to support long-term behavioral change and reduce the likelihood of future stealing episodes. Following treatment, the client demonstrated a significant reduction in stealing behavior and improved control over impulsive urges. The client also reported lower levels of anxiety, guilt, and emotional distress. In addition, increased self-awareness helped the client identify behavioral triggers and apply adaptive coping strategies more effectively. One of the major strengths of this study was its structured CBT framework. The intervention provided clear behavioral techniques that could be applied in real-life situations. Self-monitoring and response prevention appeared particularly effective because they directly target the behavioral sequence leading to theft. However, several limitations should be considered. The study involved only one participant and did not include long-term follow-up data. Therefore, it remains unclear whether the treatment effects were maintained over time. The study also did not compare CBT with other treatment approaches, limiting our understanding of alternative intervention options. Although the two studies focused on different disorders, several similarities can be observed. Both interventions were grounded in CBT principles and aimed to modify maladaptive behaviors through structured therapeutic techniques. Both studies emphasize self-awareness, self-regulation, and the development of adaptive coping strategies. However, there were also important differences. The ODD intervention was child-focused and relied heavily on environmental modification through parent involvement and educational support. In contrast, the kleptomania intervention focused primarily on individual self-management and impulse control. From a behavioral modification perspective, the ODD intervention emphasized external reinforcement and environmental contingencies, whereas the kleptomania intervention emphasized internal self-regulation processes. Together, these findings demonstrate the flexibility of behavioral interventions across different psychological disorders. In conclusion, both case studies provide evidence supporting the effectiveness of behavioral interventions in addressing complex psychological disorders. The ODD intervention highlighted the value of combining CBT, parent training, and educational support to improve behavioral, emotional, and academic outcomes. The kleptomania intervention demonstrated how CBT techniques such as self-monitoring and response prevention can effectively reduce compulsive stealing behavior and strengthen impulse control. Overall, these studies reinforce the importance of individualized treatment planning and the practical application of behavioral modification principles in clinical settings. As we conclude our presentation, it is clear the behavioral interventions remain powerful tools for promoting positive behavioral change and improving psychological well-being across a wide range of disorders. Thank you very much for your attention. We appreciate your time and interest in our presentation, and we would be happy to answer any questions you may have.